Have you ever wondered how we know if psychotherapy works, and what makes some treatments work differently than others? Or how we provide support to therapists as they learn to provide effective treatments, and how we know how they apply their training once they're in session with their clients? Right now, if people want to find out what is happening in session and what things that happen are most helpful, they'd have to listen to all of your sessions. That might not be something that everyone feels comfortable with, and I'm sure you can imagine takes a lot of time. We are trying to find a more comfortable and efficient way, and we want it to be one that the therapists and their clients find as simple to use as possible. With funding from the National Institute of Mental Health, we launched the imAPP study. imAPP stands for Innovative Methods to Assess Psychotherapy Practices. We want to include therapists and their clients in that process. We want their experiences to inform our work. We did some preliminary research that showed us that there are a couple different things that might work. One way would be to ask therapists to share clinical notes without any identifying information. With the clinical notes would be a checklist that shows some of the things they did in session. Another way that might work is to look at the CBT worksheets that are completed in session during treatment. We could do that by collecting paper copies or by having them completed on a mobile app. We are planning on comparing these two methods with the information we get from the recordings to see if they map onto each other. We will also see if the information gathered in the two methods relates to changes that clients experience during therapy. We are inviting people who are engaging in or using strategies from cognitive behavioral therapies for depression, anxiety disorders, and PTSD. Half of the clients will be randomly chosen to do worksheets using an app, and the other half will do them on paper. We collect the worksheets, notes, session recordings, and data on symptoms and functioning. We keep the information we collect on very secure servers and restrict access to that information to only trained study team members who take confidentiality very seriously. We don't store the data with names attached to it so that it can be used as anonymous as possible. At the end of treatment, we will ask therapists and their clients to participate in short interviews on the phone to get all of their feedback on the different strategies we use. The feedback they provide will help us understand what the best strategies are to find out what's happening in sessions so that we can train and support therapists who provide CBT and learn which elements are essential to recovery. The imAPP study includes researchers and clinicians from the University of Pennsylvania, Massachusetts General Hospital and Harvard Medical School, Boston University, Stanford University, and the National Center for PTSD. We are recruiting therapists at all levels of experience and expertise in cognitive behavioral therapies for PTSD, depression, and anxiety, as well as their clients who are interested in participating. We're very excited to partner with therapists and patients in private practice, community mental health, and VA settings in this study, and we look forward to learning from them. Keep an eye out on this website for more information and for the results of our pilot study on this approach. Thank you for watching.